Here.
All right, well, good afternoon, everyone. This is Brandon Gare with the National Minority Quality Forum for our Friday webinar series. It's our opportunity to sort of go ahead and maybe help educate and teach some folks about what's happening in the healthcare space from our perspective at NMQF and with a lot of our partners. So today I'm actually going to be, instead of giving it to somebody, turn it over to somebody else to moderate. I know these two folks pretty well, so I'm gonna go ahead and moderate this one myself. So bear with me. I'm not, your usual me or Sharia, but I think I could. I'll try my best to handle it, especially with today's topic on industry and nonprofits working together to tackle health disparities. And obviously, the National Minority Quality Forum is a nonprofit, and we work a lot with industry to do that. So I thought it'd be appropriate if I were to sit on this as a moderator of this panel with Dr. McRae and then Mr. Johnson. So without further ado, I'm just going to introduce our two speakers, and then just after I introduce them, I just wanted one question for them: what brought them here today? And so first we have Dr. Jacquelyn McRae. She's a Director of Policy and Research at PhRMA. She's focused on advancing policy and research in health equity and the value of medicines. She graduated with a Doctor of Pharmacy from Mercer University and a Master of Science in Applied Health Economics and Outcomes Research at Thomas Jefferson University in Philadelphia. Is that correct?
Yep.
Yeah, okay, cool. She previously completed a two-year postdoc fellowship in health economics and research and population health. In addition to her studies at PhRMA, Dr. Ray studies pharmaceutical health services research intersectionality as a PhD candidate at the University of Maryland, Baltimore. She also has ties to Norfolk State. I want to make sure that I got that shout out there too.
Absolutely.
So, Dr. Ray, before introducing, I'll let you go ahead and tell me what brought you here today.
Certainly. Well, first off, it's really an honor to be here today to be speaking about health equity and really partnerships with communities. First off, you heard a little bit about my background, but I'm a pharmacist by training, and I did a lot of my work in Atlanta and just really saw how so many patients don't have access to medicines, right? There's so many barriers when you get to that pharmacy counter and you need your access, whether that be to your health insurance status, or whether that be because you're an immigrant population, you don't have the necessary patient advocate, right, to really help you be able to access medicines. And so in my work at PhRMA, again, we're representing the leading innovative biopharmaceutical companies in the world to make sure that patients have and are able to live their healthiest and healthiest lives possible. And so one of the first initiatives that we formed most recently is the Health Equity Initiative. And I'm happy to be helping to lead a lot of that research in that area. And so one of the first initiatives that we formed with that was the Collaborative Actions to Reach Equity program, or CARES grant program. And this program really aims to partner with community-based organizations and other organizations that have the mission to improve health equity, to be able to increase equitable access to medicines and also increase health equity overall. And so since the founding of this program in 2019, we've awarded over $450,000 to community-based organizations, really to tackle health disparities. One of the grantees I'd like to bring up this morning is Bridgepomosia, which is actually a group of faith-based leaders out in Oregon. And what they saw was that there were a lot of inequities in getting access to the COVID-19 vaccine. And so particularly in African and African-American communities. And so what they did was they staged on the ground efforts and really had boots on the ground to be able to increase the equitable access and uptake of COVID-19 vaccine within their communities using culturally sensitive and inclusive practices. And they also work with their state government organization to really scale up and build up the data infrastructure in that community to be able to, track, right, how the COVID-19 vaccine was being uptaked in the specific community. And so we're really proud of those efforts and other grantees' efforts as well. So really, we pretty much knew that as we started the Health Equity Initiative, that being and centering and working with communities was a really big part of that, because we can't and shouldn't do this work on our own. It's really important for us to be working hand in hand in communities, because the best solutions to health inequities come from within communities. And so we recognize that. And so the CARES Grant program is a big part of what we've done. This last year, we also saw that there was a void in data. We know that we can't tackle health disparities that we can't measure. And so we've also really promoted equitable and robust collection and reporting of data that's, of course, ethical, that aligns with ethical standards, because we don't want data to be harming communities, right? We want it to be helping communities. And so one thing that we've also done is given a grant to Morehouse School of Medicine so that they can build within their health equity tracker modules on cancer screenings, as well as access and use of medicines. What we found is that there's a lot of information on disparities in chronic disease states. The CDC and CMS does a really good job of that with publicly available data, right? So that communities and patients are able to go within those communities and see, how does my rate of cancer, breast cancer, or chronic disease, right, compare to my neighbors across town. However, there's no available public data on access to use of medicines. And so we're really proud of that effort as well, which will be kicking off soon with, again, Morehouse School of Medicine to really promote and build that out. So we really, from these efforts, really have seen that, partnering with community organizations, nonprofits is really key to be able to tackle health disparities. So love to hear more from Mr. Johnson and also the attendees as well, to learn a bit more about what others are doing and, how you all may be able to help us in our efforts.
All right, thanks so much, Doc. I'd also like to now introduce Mr. Johnson. Just point of information, I've known Mr. Johnson for years, actually before I started my term at NMQF. He is a sort of a mentor and a friend, but he heads up the Memorial Foundation, which it was foundation to promote awareness of Martin Luther King Jr. And his tenets of democracy, justice, hope, and love, as well as support for the general upkeep of the memorial for years to come. I guess he splits his time between Washington, D.C., and then his home of Houston, Texas, where he raises 3 kids, and he's a graduate of Xavier University, where he met his wife. And so because of that, I'm wearing Mr. Xavier University. In honor of that, for 2001 to 2004, he was the national president of Alpha Phi Alpha fraternity, and has taught at Thurgood Marshall School of Law, his law school alma mater. And for all of his work and his dedication, he's been honored on a variety of ways, including being listed as Ebony Magazine's 100 most influential for quite a few times. So Mr. Johnson, thank you so much for your time, and just tell us why you decided to join us here today.
Well, thank you so much, Brandon. It's a joy. And Dr. McRae, thank you for joining us as well. I've known Brandon for quite a while. He and my kids grown up together, but he's a good friend and good family member. So we appreciate him and all his efforts and things that he does. As stated, I am the president of the Memorial Foundation. What really brings me here today is basically the fact that not just that I raised $127 million to build the lovely memorial behind us, which stands on the mall in Washington, D.C. Martin Luther King Memorial is now the 5th most visible memorial on the mall. When people, especially people of color, go to D.C., they make 2 stops. Number one, the stop at the Martin Luther King Memorial. The other one is the African American Museum. And the whole thought behind Martin Luther King Memorial was to bring individuals of color to the mall. That was the whole idea when the members of Alpha Alpha created the idea. However, it has become much more than that. If you visit the Martin Luther King Memorial, you see people of all hues, all races from across the world. And that speaks to what Dr. King really emphasized in his life, and that is inequities across the board. So what brings me here today is to talk about some of the programs that we do at the Memorial Foundation. We do things like give away food. So we take a look at what's going on in the country. And a couple of years ago with the pandemic setting in, I was driving around Houston, Texas, and I saw just lines, and you did too in your cities, lines of cars of folks with their trunks open, getting boxes of food. I'm going like, daggone, I said, this thing is really affecting everybody. And as Brandon said, some of the tenets of the memorial is justice, hope, democracy, and love. So I said, what better way of showing love than to give away some food? Because that's part of all this health inequities, is part of living and growing a healthy body. So a couple of years ago, we gave away 550 boxes of fresh food at the memorial. We did that for 2 years straight. So my idea of the memorial is being more than just a piece of stone in Washington, D.C., but being part of the community in D.C., but then doing other things around it. So therefore, we came up with other programs such as our Social Justice Fellows Program, where we had 50 young men and women from across the country. And part of their cohort, part of their capstone project was to talk about health inequities and disparities and how to get back in their community and make a change. The other thing that we do very well at the Martin Luther King Memorial is we have a global youth leadership conference where we bring young leaders to talk about the leadership principles of Dr. King. So the other program, and I'll shut up on this one, is our conversation series. So we actually brought together, so we need to do a conversation series around key issues. So this year we did one on home equity and home ownership. Today we're proud to partner with Brandon and PhRMA to talk about health disparities. And we will do another one with Secretary Pete Buttigieg to talk about infrastructure and how it affects our community. So how proud I am to be a part of today's panel as we talk about health disparities, what we should be doing as nonprofits, government, and just individuals to make sure that we capture and eliminate health disparities in our communities.
All right. Well, thanks so much for that, Mr. Johnson, and you too, Dr. McRae. Just some housekeeping items really quick. If you have a question that you'd like to ask, below the screen, there's a Q&A box, so please put the question there. If you have any topics or things that you're just interested in topic and being engaged, and we have a chat feature, so put everything in the chat. And as you see, as people speak or bring up points, Keiko will put links to different items there. So just please participate in that way. Additionally, I'm just going to ask us to delve a little deeper into that, essentially what you both started talking about, which is like why both your organizations, both PhRMA and the MLK Memorial Foundation, are interested in eliminating health disparities. Why is that important for you in not only your organization, but your role as a leader in the organization? So it's for both, so anyone can go first.
Okay, Dr. McRae, go ahead first. I'll follow up.
Sure. So yeah, again, PhRMA started this health equity initiative in 2020. And it really started with, we knew that we had to do something, with the killings of George Floyd, Breonna Taylor, and so many others. We really wanted to acknowledge, right, that racial health inequities are real and they impact everyone. And our industry is not immune. So in the wake of the killing of George Floyd, we actually released our racial justice principles and also an ad that said that systemic racism is real, is a disease, and our industry is not immune. And so that was, one of our bold statements that I'm really proud of that we put out around health equity. And since then, we've been really building out our pillars and work within kind of 3 domains around improving health equity. The first one that I sit in is improving policies to improve equitable access to medicines. And so as we've seen from literature, right, for probably decades, unfortunately, Black and Brown communities have lower adherence across a number of different diseases and lower use of medicines. But that's no blame to the individuals themselves, right? That's really due to systemic inequities, disparities, social bias, et cetera, all these things, right, that really compound to lead to these poor health outcomes among Black and Brown Americans. And so we're developing and have developed policies to be able to curb those health disparities, particularly in the use of medicines. Our second pillar focuses on clinical trial diversity. And so just earlier this year, we launched a new initiative to improve clinical trial diversity to ensure that populations who need access to clinical trials, where oftentimes you get the latest breakthroughs in medicines, right? They can have access to those medicines. And then lastly, around talent, right? We recognize that in order to have diverse perspectives in the pharmaceutical industry, we need a diverse talent set, folks who are trained in STEM, folks who are trained across a number of different backgrounds who can really help to empower our organizations to ensure that we're getting the most diverse perspectives possible. And so we also have a talent initiative as well. You asked a little bit about, why I'm passionate about this issue. I'm a data nerd, but I recognize that data is people, right? Every time you have someone in a data set, that represents a life, that represents a perspective, and that person has a history, right? They have a legacy. It's really an honor to be here with Dr. Johnson today, and also NMQF that's really has improved the lives of Black Americans for so many decades. And so within my research, I'm interested in pulling that through, right? Oftentimes we look at people and we evaluate data as like one step in time, but there's really a legacy in history that is tied to that. So how can we tie the health outcomes that we see now and the disparities that we see now to social justice that's still having an impact right today? With access to healthy food, as Dr. Johnson was talking about, or just access to the internet, something that seems so simple. A lot of times it's not simple. And so this work definitely resonates with me as the great granddaughter of a sharecropper from the South. I feel like it's, my mission to help ensure that patients and individuals and communities can have, the best outcomes possible, and that we all have the ability to live our best lives. So thanks for that.
All right, thank you. Mr.
Well, let me
Johnson?
just say this, great comments, Dr. McRae. Why am I passionate about this? I think many of you know there are like 14 different quotes at the Martin Luther King Memorial. And these are different quotes that Dr. King gave throughout his life, different variations of time. And some of them are: make a career of humanity, commit yourselves to the noble struggle for equal rights. You will make a greater person of yourself, a greater nation of your country, and a final world. Another one, he talked about injustice anywhere is a threat to justice everywhere. We're caught in an inescapable network of mutuality tied in a single moment of destiny. Whatever affects one directly affects all indirectly. And then finally, one of my favorite quotes over this: I have the audacity to believe that people everywhere can have 3 meals a day for their bodies, education, culture for their minds, and dignity, equality, and freedom for their spirits. Now, we add those 3 quotes together, we're really talking about being a better you and a better self you. When we talk about health disparities, and Dr. McRae spoke on this about social justice, you can't be a social justice advocate if you're sick. You can't be a social justice advocate or an advocate for anything if you can't get quality health care in your community. So I am tied to this mission because it all makes us part of one. Dr. King stated in a speech, 1966, of all the forms of inequity, injustice in healthcare is the most shocking and most inhumane. So this is back in 1966. Let's talk about what has changed since then. I would probably say very little has changed. When we talk about health inequities in our communities, how can we make that better? Well, in Houston, we have one of the best medical centers in the country, in the world, in DC and other places. However, you get outside of the urban areas, you go out, there are no hospitals. I was, a couple of weeks ago, I was talking with somebody and they said, look, what's going on down in Wharton, Texas? And Wharton is some 50 miles from Houston. Say, hey, if somebody gets sick down there, there is no hospital there. You take them to urgent care. Well, what is urgent care going to do? It's going to prop you up and then fly you over to the next hospital. So the question comes up is that we talk about these inequities, is that we need more hospitals, more healthcare facilities in our community. And we have to be cognizant enough to take advantage of them. What do I mean by that? I simply mean that we can't sit back and wait until we get deathly sick and ill and run over to the emergency room, but we have to do preventive medicine. We have to do things, and I digress a minute, that I was with some cousins of mine in Detroit last week, and they looked at me and said, are those your real teeth? I'm like, what? They said, are those your real teeth? I said, yes. Somebody, you probably the only man in the family over 60 that got his real teeth. I'm going like, what? What have y'all been eating? So it's in our family. It hits home that all of this really comes about by how we raise our kids, how we teach them, where we direct them to say, hey, you got to take care of your body. I go back to my first point. If you're going to be an advocate for social justice, if you're going to be an advocate for your community, you got to be healthy. So you got to eat right, you got to do right, and then you also have to take care of medical things to make sure that you look good, speak good, but also you are healthy.
Wow. Yeah, this is all true, and both points. I would point to back in 2019, NMQF's annual conference. The title of the program was "Racism Makes Me Sick." We got that from Dr. Cameron Webb, who's a senior advisor at the White House on health equity, and he's one of those crazy folks that has both a JD and an MD. So he teaches us into both his health, his medical students and his law students. And so a lot of the points that you both mentioned sort of illustrate that, racism does indeed make us sick. And then I love those points about diversity and diversity and inclusion, and making sure that you have a good workforce that does that. And then all of the, like Mr. Johnson mentioned, we've been, what's changed really since 1966 as far as the data numbers, what has really changed? And honestly, not much. We've had these very, very small incremental movements, but they haven't been as big as they should be. And I think we kind of came to a point in, mid 2020 where people started to recognize this. But, and you guys have been partnering with us forever, and NMQF has always been speaking about health equity, but now at least it's getting a bigger audience right now. Mr. Johnson, I just want to continue with you. One of the things you did was you raised $127 million to sort of build that landmark that sits behind you right now. One way we realized that industry could do that is through and support nonprofits is participation on advisory and educational boards. You serve on a variety of them: AARP Foundation, Urban League Board, March of Dimes. What advice can you share on how to make the most important, the best of those relationships in this capacity as you're partnering with their for-profit organizations, the industry, to sort of reach your goal, whether it's to build what's behind you or to change health?
Sure. Number one, I no longer serve on the ARP Foundation board. When I was on there, though, we talked about, they sit around and come up with ideas of what's best for how to spend their money, and they got gobs of money, right? So they talked about food deserts and how ARP Foundation could help with these food deserts and what we should be doing and who they can partner with. And I started laughing at a meeting about, y'all don't have a clue as to food deserts and what happens in African American community. I hate saying it, but you just don't. And then I said, we're focused on folks over 55. I said, probably need to look at families, because in our communities, if somebody is 55 or older, their grandmother, they may be taking care of their grandkids, their great grandkids. So you can't cut them off and provide food to the grandmother and not provide food to the grandkids. And so you have to look at the whole family and what we really do. I then also said, you all have not a clue as to what people live on in our urban areas. I said, have you all ever heard of Vienna sausages or potted meat? And they're like, what is potted meat? I'm going like, that's my point. My point is, you all want to throw money at an issue, but you don't understand how these folks are really living. And then another colleague jumped in and said, well, potted meat is just the ruins, what they did at the meat packing factory, put in the can, say, here you go, people put on crackers. I said, so if somebody's eating potted meat and Vienna sausage on a daily basis, do you understand what that does to your hypertension? Do you understand what that does to your blood? Do you understand what that does to your physical body? That you don't have the necessary vitamins and nutrients to have a productive life. And so I think partnering with different boards, different foundations, is coming up with an understanding that, hey, I'm glad I'm on this board, but let me just help you out to understand what folk that look like me need and deserve, because they don't know. All they know is we got some money, let us throw at a problem. Typical example of what happened after George Floyd. Corporations and foundations threw money and say, here you go, here's 40 million, here's 20. Not understand, hey, do X, Y, Z with the money, but let me get rid of some guilt money and say, we feel bad at what happened. If you're a board member, or if you seek to be a board member on one of these foundation boards, then it's your duty, it's your job to enlighten your colleagues and the president or executive director of that board that, hey, we ought to be doing X, Y, Z in this community, that community. And maybe it doesn't fit within our definition of what our purpose is. Sometimes you got to think out the box. And a perfect example is the one that I mentioned about AARP, 55 and older population. But hey, what about the grandmother in East St. Louis that has her grandkids that she's raising because the kid is no longer around or something like that? So that's kind of my word to anybody who serves on the board, is think out the box, understand that you can make a difference, and understand also that your colleagues don't necessarily know what's right for your community.
Mhm.
Yes, think out the box and raise that 127 million, right? Yeah, it's got to go back to that number. Sorry. Dr. McRae, one of the things that we discussed in preparation is that CMS has and a number of other agencies within the federal government released a great deal of information, plans, strategies to improve equity in healthcare. What do you think are some of the best approaches that the federal government can take to tackle health disparities?
Thanks for that question. Man, CMS and so many others are doing so much on health disparities and health equity, and we really commend those actions, right, to ensure that health equity is like a central part of healthcare delivery. I think, though, that health equity, in order to ensure that the federal government is doing a good job on that, some opportunities include, for one, like I said earlier, we can't figure out if we're moving the needle on health equity if we're not measuring it. And so I think a central part of these development strategies need to be assessments, right? We need to be going to communities and asking them, hey, as you're collecting information on health equity and health outcomes gaps, like, can we do this in a way that kind of best serves you better? Are we ensuring that we're collecting information in a way that is culturally sensitive and culturally inclusive, and making sure that we're really closing these gaps? So I think that assessment strategies need to be a central part of that kind of development process in these programs. I think another really big thing is, like I said earlier, making sure that we're having culturally inclusive practices, right? So ensuring that we're not missing subpopulations that are oftentimes hidden. So ensuring that, the materials are developable in different modalities and languages, so that everyone can access them. Because oftentimes we will miss populations that are hidden, again, because, we're simply not giving it to them in a way that kind of speaks to them. And so that kind of leads to my third point, which is, I think that we have to center these policies on communities and making sure that we're working hand in hand with different communities, because we know that different communities face different barriers. As I said something earlier, something as simple as broadband access or high-speed internet access. It may sound really, really simple to most, but there are some areas that, still have issues with that. Sanitation, clean water, right? So as we're kind of developing policies, we need to understand the needs within specific communities. And that only comes from outreach efforts. That only comes from us, like, making sure that we're meeting them where they are. And so working hand in hand and really empowering community leaders and organizations who are already doing the work of health equity within those communities is a really good way to do that. And it's also been shown that, not just asking people for their time without some kind of payment is not helpful. So as we're kind of thinking about engaging community leaders and organizations, you can also consider payment financially or non-financially for those services, to make sure that we are empowering people, but then also making sure that we're, paying them for their efforts and their work, because that also takes a lot of time, right? And so we want to make sure that we're equitable in those kind of deployment strategies as well.
Right. Thanks for that. And I kind of want to continue on the point that we talked about earlier. We kind of talked about it, I think, over the last 3 years, is just that the mistrust of the community, whether it's about getting a vaccine or asking for funding or whatever. So how do you address the mistrust within communities about, working with private sector interest in health equity, health disparities? A lot of folks say that, they're just doing it for a profit, or I don't trust they're going to take if I'm participating in a clinical trial, they're going to just take my data and sell, whatever the machinations are, the incorrect information is. What, like, for both of you, like, how do you deal with the sort of just general mistrust, and how do you sort of go from a mistrust to a trusted voice for folks.
Let me just say this, and I'm not a medical expert on that, but I can say this, that when the pandemic occurred, there were so many folks who, I'm not getting the vaccination and I'm not doing this. And I'm like, what are you talking about? So I think having the right spokespersons to say, this is what you need to do. We as a people can't afford to listen to other folks who say, look, that stuff is going to kill you. It's not going to work. But we've taken vaccinations all our lives. As a kid, going to school in St. Louis, Missouri, you line up, the nuns will say, hey, you getting the vaccination? You didn't know what the hell you were getting, but you got in line and got your shot or drank whatever medicine it was for polio. The bottom line is that we as a people have to tell our other folks in our community that it's okay to get vaccinated. It's okay to be a part of a test. It's too late once you get something, once you get cancer. The whole deal is trying to prevent it. The whole deal is understanding that there are ways that can help you live a much longer and better and quality life, to be honest with you. The old saying, remember what they said, a mind is a terrible thing to waste. And so our mental health is all a part of that. So if there's anything we could do to cut back on dementia, cut back on that, we need to do it. I was running to get a vaccine when they came out with the vaccination stuff. I was running to it because I knew people, and you all knew people who were just dying. You'd be like, what the heck is going on? And I don't want to be in that number. You don't know how you catch this, but I don't want to get it. And so we have to open up our minds and be spokespersons in our community to say, I did it, you can too. But don't be afraid, just get it done. Don't forget about the Tuskegee stuff. Understand that's part of our history, but guess what? When something happens like the COVID-19, I think that's beyond the scope of Tuskegee and experimental stuff. It's like, hey, let's get better. The pandemic shut down, not just the US, shut down the world economy. So the world economy went into a tailspin because of one particular virus. So that's why, you need to just say, look, guys, get vaccinated. You don't want to go through this.
Yeah. And I'll just say, I think that trust, just in any capacity, right, comes from relationship, and it comes from, proving yourself to be trustworthy. And so I think that as industry organizations, again, like form relationships and longstanding relationships with community-based organizations and nonprofits, then you kind of build that trust over time. But I think that it's not smart to think that you can just like have trust immediately, right? It's something that comes with time, and it's something that's earned over time. And so I think that industries, ourselves included, like as we form these initiatives and we, prove ourselves over time and build these long-lasting initiatives, right? That's how we can kind of break down those walls around not having the trust. And so I think that it's something that we've got to earn over time.
And I think this is sort of related, but Sherry Fox from Future Health Strategies had a question for you guys, and she was wondering what actions are being taken to increase diversity in clinical trials, and how can industry help and support this?
Well, happy to take this one. So I will say that,
space, right?
yeah, a couple of months ago, we launched an initiative with several partners. And I will say, if you want to learn more about it in depth, please go to pharma.org/equity. But essentially what we formed is a partnership with a number of partners, which really looks to set up community-based, longstanding partnerships that will last, so that we're able to have clinical trial diversity that's a bit more ingrained within the community, instead of having typical trial sites. And so I'm actually not the expert on this issue, but I'm happy to point Sherry to some folks who can talk to her more about it. But we did just launch a major initiative in this effort, recognizing that, clinical trial diversity is really important to think about in regard to equitable access to medicines.
Well, thanks. And then one of the things that, we've been talking about health disparities and kind of giving the whys and
Mhm.
why is this trust, or what should be done in the industry? What and you guys have had done a really good job of going from talking about health disparities to actually taking action on them. For
Mhm.
example, we did when NMQF started and we had our first conference and our first few conferences, essentially Dr. Puckering, who is also a data nerd like you, Dr. Ray, Dr.
Mhm.
McRae, he said that essentially they just kind of sat around and just talked about all the healthcare disparities.
Yeah.
And there are hundreds, if not thousands, of disparities there, especially from talking to social determinants of health to HIV/AIDS to whatever disease or therapy out there. How did you guys both move from just talking about the health equity and its importance to actually doing something about it? What was the push that made you actually get out there and roll up your sleeves and do something?
I'm happy to take this first. So yeah, how do we get to actual movement and action? I think that, really having honest conversations with community members, one of the first things that we did before we kind of started our efforts was had focus groups with diverse individuals around, what can we do as an industry, right, to earn your trust? What can we do as an industry to improve equitable access to medicines? And one of the main things that we heard was that we needed to how did individuals know, right, that they could trust us in these efforts? How did individuals know that we would be trusted partners kind of, over time? And so I think that those interactions and those discussions with people on the ground in the communities. For me, I also lead the Pharma Cares Grant program, right? And so hearing from individuals about what they need to be able to tackle the health disparities in their communities, I think it just motivates us to be able to do the work and provide the support that we can, right, to empower them. So I think you really go from listening and talking around it to action by engaging the community, to engaging individuals to learn, how can we best support you and your efforts that you're already doing to move the needle on health disparities. That way we don't have to develop the ingredients and the recipe to be able to bake like the perfect cake, right? You've already got the ingredients. Our communities are very resilient. And so kind of taking that resilient based approach and not deficit approach, and just understanding that we have a lot to learn. And so that's one of the main reasons how we've been able to kind of move to action quicker, is that, we're not trying to develop the solutions on our own on an island. We got to empower folks to be able to do the great work that they're already doing.
Brandon, from the memorial standpoint, we actually started with this with the Institute for the Advancement of Multicultural and Minority Medicines, headed up by Madeline Lawson. So we worked with her a few years ago on her committee to talk about what can happen with partnerships between our group and her group. And so we came to the conclusion that we can't do any of this stuff by ourselves, that it is a part of a team. And so at the Memorial Foundation, we found it very, very important to us that we team up with other organizations such as yours and such as PhRMA and Madeline Lawson's group to talk about the gaps in minority health and how they could be eliminated through a collaboration, not just with nonprofits, but also with corporate entities, universities, colleges, and proponents and elected offices, as well as consumer organizations. So the whole issue with us is that we like to partner with folks who are doing things to make a difference in our community. And again, to let everyone know that the Martin Luther King Memorial, which sits behind me, is more than a piece of stone. It is in fact something that affects all of us around the world.
Yeah, and I appreciate that. And I also appreciate a lot of points that were brought up. And most importantly, I don't know if anybody's like following the chat as well, but Mr. Johnson gave his information if you have any questions for him directly that you can ask here. And then Jay Jackson at Pharm also put his information, his email address. So if you have questions about what we were talking about, you can also go in and reach out to them reach out to them directly. One of the things that I remember Dr. McRae was talking about, and both Mr. Johnson was like, don't reinvent the wheel. Essentially, like you already have folks at church, like, if you're, Black churches, Wednesday night is essentially like community night, and they do a lot of healthcare items there. There's fairs and roundtables and stuff that we do. What are some good examples that you've seen where you were able to get in community? Just to illustrate, one of the things that we've done with NMQF, we have a corporate roundtable, which PhRMA is a member of. And essentially when as we're coming out of COVID and that thing, people are more willing to meet, we're doing it again. But prior to that, we were able to work with a church, an elected official, and the community leader to have a big community health clinic, right? Just to get folks out there. And that was like one example of us working with our corporate roundtable and then the local partners. What are some examples that you say you have done that, I mean, whether it's the CARES thing, whether it's the, you got to get the groceries from somewhere, like when you get it, how did the partnership start? And was it just an ask and somebody moved forward, or is it, how did it come into fruition?
Well, I'll say it's simple like us. We just look for partners to do great things with. Whether it's our food giveaways, we partner with Giant Foods and Whole Foods and others. But also you reach out to local community politicians, say, we need you to be a part of this, because what we're doing is not for ourselves, but for others. And so we've done that through our food program. We've done that through our conversation series. So how proud I am that we are partnering with PhRMA, one of our supporters, to do this today. But also we look in the future, because whether it's General Motors, whether it's Ford, whether it's Wells Fargo, some of our other sponsors, they always look for what else are you doing in the community to do and inform the community about the good things that you're doing. So it's not necessarily all the time when you look at General Motors, they want to, hey, what are you funding? We're funding social action. You look at Wells Fargo, we want to talk about banking and all that. But we also want to talk about health, because if folks doesn't have good health, they can't get to the bank. They don't know how to spend their money. The other pieces, we talk about broadband. So we're working also with some telecommunications companies, T-Mobile in particular, because as we talk about the future of medicine, you're going to have broadband. You're going to have a hotspot to talk to doctors. Doctors now want to see more patients, but they want to make more efficient at the time. So they're doing telemedicine. But folks in our community we don't go to the doctor when we're sick half the time. So trying to get grandma and grandfather to get on a call and say, pick up the telephone, let's do a call with a doctor. Like, what? Talk to who with a what phone? So it's basically informing them of what the power of the internet can be to help with that. So we're here to partner with anybody that's willing to help our community.
You'd like to follow up, Dr. McRae?
She's on mute.
Thanks, having some technical difficulties. But one of the main, so again, we saw this void in not having information on disparities in access and use of medicines. And, rather than kind of going out there and starting a tracker on this ourselves, I mean, we think this information is important because, again, if folks don't have access to medicines, a lot of times that's one of the main things in their treatment paradigm that they need, right, to be able to live a healthier life. And if community advocates and others don't have access to the medicine, then you're not able to kind of close those disparities or understand what kind of barriers may be in your community to not being able to access it. And so rather than like forming a tracker on our own, again, we went ahead and used the recipe that Morehouse School of Medicine already had, which is a great health equity tracker, which includes information on COVID-19 vaccinations, in cases and mortality related to COVID-19. It also includes information on chronic disease. And so we saw this as an opportunity to provide grant funding to Morehouse to say, hey, how about we just include this information on your tracker around areas that we know could be valuable to your stakeholders, right? Your policy influencers. And so rather than doing that on our own, we saw an opportunity to really be able to leverage the work and the great work that's already been done. So that's just kind of just one example around a way that we do that. Again, with the Pharma Cares Grants program, we also are not just giving out that money, but we're also doing it with the idea of finding potential practice guidelines, right? And scenarios that can be scaled up and leveraged in other communities to be able to tackle similar problems. And so that's another way that we're leveraging the great work that communities are already doing to see how we may be able to foster those improvements in other scalable communities. And we're just kind of getting started with deciphering and understanding what we can learn regarding those great recipes within individual communities to be able to scale up. But we hope to be able to leverage out and promote that information that we're learning from those communities in the near future.
Yeah, and then speaking of community, I think one of the things I think I mentioned it earlier, and then it was mentioned by both of you: equitable access to care, or equitable access specifically in this question to medicine. One of our attendees who remains anonymous would like to see manufacturers. What can manufacturers do once a product is on the market to better reach communities that have historically experienced low access to advanced therapeutics or have worse outcomes? Marketing efforts, partnerships with community leaders, whatever. What are the best ways to sort of get that out there and provide this service or this healthcare service to folks?
Oh, I didn't know that was a question. Okay. Yeah, I'm thinking about, so there's definitely, I think that kind of gets into the policy conversation in space around, what kind of policies do we support to be able to ensure that medicines are equitably accessed. From one of the things that we see and we hear from patients is that healthcare insurance barriers, right, are some of the main first barriers, right, that patients have to be able to access medicines. And so we would love to, we do support policies that promote ensuring that patients have lower out-of-pocket costs right at that pharmacy counter, because we know that for individuals who are lower income, that additional $50 to pay out of pocket to access that medicine, it may be a really significant barrier and lead to you never going to fill that medication, or you not going to be adherent, after you get that first fill. And so policies such as ensuring that patients have the lowest out-of-pocket costs possible through things such as $0 coverage of preventative medicines, as well as ensuring that we're also passing through rebates that are received to patients directly is a really big thing that we're hoping that patients would have access to, so that they can have the lowest out-of-pocket cost possible to be able to access those medicines. I would say another big thing that we're interested in doing is, again, leveraging and having more information and data available on these disparities, right, in access to medicines. Like, we know that they exist, but there's just not a lot of good information out there, particularly when you start talking about hidden racial and ethnic groups. And this is just systematic because of the way that information is collected. A lot of times we're missing information about populations that we know that exist, but they're just not built into the data. And so we're interested in promoting practices and strategies to make sure that race and ethnicity data speaks to the diversity of the populations that we serve. And so also ensuring, again, that those data practices are ethical in their collection, so that, again, that data is not harming communities, but helping communities. And then I think lastly, another policy that we definitely promote and are looking into is, again, figuring out opportunities and strategies to partner with, support community-based leaders in communities to ensure that we're finding out, what are the specific barriers within the community to be able to access medicines. For example, another big problem in large cities, one example is Chicago. We know that there's pharmacy deserts, right? Places that have that are pretty walkable, but however, there's no local pharmacy. And so patients then have to travel 30 plus miles to be able to access their medicine. For some family members of mine who don't have cars and have lower incomes, that's a real issue. And so how can we also ensure that we're, again, meeting patients where they are and really figuring out what specific barriers so that they can have that equitable access.
a great conversation. One of the things I would say simply is this, that when we talk about how to get the word out, number one, you use your community-based organizations that exist. So there's nothing wrong with being partners with the Urban League, being partners with the NAACP or churches because of their population, especially the churches who are elderly, who don't understand how to get their medication. The other good thing that's happening right now, all of you who are this Gen X and understand what's going on, you get Uber can pick up your medicine and bring it to you. So it's basically telling communities, here's how you can get your medication. I get daily texts from my pharmacy, hey, you're going low on X prescription. Would you like us to refill it? But also they do home delivery. So while we do have deserts in the cities and outside the cities regarding pharmacies, there's a way to get the prescriptions. However, you also have to be conscious of the fact that these folks don't understand. So I think our pharmaceutical companies, our commercial companies need to tell the people, here's how we can get your medicine. It is shipped to you free of charge. We can have Uber delivered to you. We can have Lyft delivered to you. Those are services that can happen. So part of this community awareness and commercial appeal awareness as well. To understand how do you get to the population? Because again, if you don't know, you don't know. You have to ask somebody.
That's true, and that's one of the things I guess my mom always told me, never be afraid to ask. You never know. Don't turn yourself down, right? This has been a great conversation. I'm going to let everyone know that we only have a few more minutes left. So if you have any sort of last minute questions that you have for Mr. Johnson or Dr. McRae, please enter them on either chat or the Q&A box. And before getting to the I think if there are no more questions, I'll give us a little time for you guys to think about this. But what are sort of any final words or comments that you'd like to share with the audience? I know we've gotten a few questions that were submitted earlier, like how can my organization work with you in the breast cancer space, to what are some policies that I think we've talked about that promote health equity, but what are your last, I guess, parting words to our audience, and how industry and nonprofits can work together to improve health equity?
Sure, I'll go first. Number one, thank you so much, Brandon, your team, for pulling this together. Thank you, Jay Johnson, Jackson, for your help in pulling us and being a great sponsor with PhRMA, to the Memorial Foundation. I would simply say this in a nutshell. My pastor always say, this thing called life is not a dress rehearsal. So you only get one body. You only get one chance to abuse it and misuse it. So you have to take responsibility to make sure that you are in the best health you could be, that you're doing the right things to make sure that you have a long-lasting life so that you can pass down your knowledge to generations yet unborn. At the Memorial Foundation, we pride ourselves with partnering with almost any and everyone that want to help the community to spread the word about justice, hope, democracy, and love. And that also includes health wellness, health awareness, and closing the health disparities gap.
Yeah. And what I'll say is that, first off, thank you all for this great, amazing panel. Again, it was really an honor to be here today. And thanks to my colleague, Jay Jackson, for pulling this together. I guess my final comments would be that, gosh, we've got a long way to go to be able to ensure that we have health equity centered in healthcare policies, and just remembering that this should really be on the top of the mind for all of us, right? As even we, go down the years past the big upheaval of racial unrest that we saw in 2020. And so I just welcome all the attendees today to partner with us in our efforts so that we can learn more about specific communities and how we can best serve you as an industry, and so that we can continue to earn these relationships, right, that we're so grateful for. So just thank you for the opportunity to be here with you all today, and hope everyone enjoys your weekend.
All right. Well, thanks so much. I know that you guys are both extremely busy, and you just kind of took not only an hour today to participate, but I'm sure there's a lot of background and research that goes into being prepared for the questions of this very intelligent audience. So I just want to thank you both. And one of the, I guess, the main theme that the word I heard the most, two words I heard the most throughout this presentation were equity and partnership. And so I want to continue with that. I just want to be very transparent. And I know that it was typed in there, but Mr. Johnson is at hej@flash.net. And then if you have a pharma concern question partnership, I would go to Jay Jackson. It's J, the letter J, Jackson @pharma.org. And those two individuals can work with you on any particular or potential partnerships out there. And then also we talked about it a bit on this call, but next week, our webinar is going to be on treatment access and health equity, protecting the value of copay assistance to improve patient outcomes. So it'll be more or less a continuation of today's call, where we go specifically on how do we make or keep drugs much more affordable for those that need them to be more affordable. So with that, I just want to thank you. And again, everyone have a good weekend. I know that some of you have some folks from Los Angeles here, it's still the morning there. Everyone else have a good afternoon, and we'll see you next week.
Thank you.
All right. Thanks, folks.
Bye.